Hi, we're going to do an abdominal assessment on patient Mr. Sherdoff. This video is for instruction, educational use only. Please note during the assessment I'll be talking to the patient, but I'll also be talking out loud about the types of things I'm going to be assessing and documenting in the electronic medical record. I normally would not share all of these findings with the patient during the assessment, but in order for you to understand what I'm looking at and what I'm finding, I'm going to be verbalizing those out loud.
Come in.
Hi, Mr. Sherdoff. My name is Sheila. I'm going to be your nurse today.
Hi, Sheila. I've been waiting for you.
Ah, okay. Well, I'm sorry to have kept you waiting.
No, perfect timing.
How are you feeling today?
Well, I want to get out of here.
I understand that. If it's okay with you, can I just take a quick peek at your wristband?
Sure.
All right. And can you tell me your name and your date of birth?
Sherdoff, 3/14/69.
Okay. Thank you very much. So first I want to start off with a couple questions. Can you tell me when's the last time you had a bowel movement?
This morning.
Okay. And was it normal for you?
Yes.
Okay. And can I ask you how often you normally have a bowel movement in a week?
Every morning.
Okay. And then have you ever had any type of abdominal surgery?
No.
Okay, great. So first thing I'm going to do is look at the side. And right now I'm just going to be looking, okay? And I see that the abdomen is rounded. I'm going to look from the bottom of the bed. And looking straight up, I see that the abdomen is symmetrical. Okay, and as I am looking at the abdomen, I'm going to note the umbilicus. It's intact. It is inverted. I'm also going to note the skin. The skin's appropriate for ethnicity. In addition, Mr. Sherdoff, I'm noting that you have maybe some scratches on your abdomen.
Yeah, dogs, they like to jump on me in the morning, wake up, and get silly.
Do they heal pretty quickly?
Well, right away until they do it again.
Okay, all right, great. I'm also noting that there are some cherryangiomas on the skin. There is some nevi, and I do see some striae, which would also be called stretch marks. Okay, looks good, thank you. I'm also looking for any pulsations on the abdominal area, and the only thing I note is respirations here. Next, I'm going to just take a listen, okay? All right. Okay. So I'm going to listen to your bowels before I palpate or touch your abdomen because I don't want to create any extra sounds, okay? So I'm just going to gently listen. I hear nice active bowel sounds. Bowel sounds tend to occur every 5 to 30 within a minute, and his bowel sounds are normal active. I'm also going to take a listen to some of your vessels, okay? So I'm going to find the bottom of the xiphoid process, the umbilicus, 2/3 down, and this is where I will be listening to the aorta. I will document it as negative for bruit. I am also going to listen to the renal arteries, which is an inch above the umbilicus and an inch left or right of that. That is negative. I'm also going to listen to the iliac arteries, which is an inch below the umbilicus and an inch left and right of that. and that is absent. Sounds great. Normally when I'm assessing those areas, I may hear some type of sound like a bruit, and that may be another vessel in the area that I'm hearing. But a normal finding we would assume is going to be an absent sound from those areas. Okay, now I'm going to go ahead and palpate your abdomen. What that means is I'm going to be touching it, but I'm going to be pressing down. So the first time I'm going to be pressing just a little bit, and the second time when I go around I'm going to be pressing it a little bit firmer. So it might feel a little uncomfortable. Do you have any tender areas on your abdomen?
No,
Okay, so if you feel any pain, please let me know because I don't want to hurt you, okay?
sure.
All right, so I'm going to go ahead and start with my pads of my fingers in a circular motion, pressing down about 1 centimeter. I'm going to be palpating all around. Take your time, don't feel rushed. You may hear some vowel sounds that are audible as you do this. We're waking up the bowel a little bit as we palpate. Okay, and my documentation is going to reflect no lumps, no masses palpated. Mr. Sherdoff, I'm going to be pressing a little bit harder now, okay? I'm going to be pressing about 5 to 8 centimeters. So please let me know if you have any pain. Is that okay?
Mm-hmm.
All right. I want to make sure I'm pressing hard enough as I do this. Okay. Again, take your time so that you cover all the area. And we are palpating for any lumps or masses. And as I do this, I actually can feel some of the colon loops. You may or may not feel that. Okay, you feeling okay?
Mm-hmm.
Is there any area now that's tender?
No.
No pain?
No.
Okay, all right, excellent. All right, so that concludes our abdominal assessment. Mr. Sherdoff, thank you. Is there anything I can do before I leave?
Just get me out of here.
Okay, we'll work on that, all right? Make sure your call light's close and your phone's nearby. All right, thank you.
Sure.